Your medical device isn't just hardware anymore. It's a computer, one that can receive updates from miles away. And like any computer, it can change. You don't think about it that way at first. It's prescribed, installed, explained in calm, clinical language. It's described as support, assistance, peace of mind. Maybe it regulates something quietly in the background. Maybe it monitors. Maybe it delivers. The human decision here is trust. You trust the doctor. You trust the manufacturer. You trust that whatever is inside your body or attached to it is stable. The consequence is intimacy. This isn't a phone you can power off. It isn't a car you can park. It's closer than that. And most people never hear this part. Many modern medical devices don't just function. They connect. They sync with apps. They transmit data. They receive wireless updates. Not because something went wrong, but because medicine moved forward. Remote updates mean fewer surgeries, fewer appointments, faster improvements. That was the human decision. Prioritize progress and convenience over permanence. The consequence is that stability becomes flexible. Your device can behave slightly differently tomorrow than it did yesterday. Not dramatically, subtly. A timing adjustment, a sensitivity tweak, a background change you won't feel until you do. Here's where it gets uncomfortable. When a device lives inside your body, update means something different. If your phone updates overnight, you might notice a new layout. If a medical device updates overnight, you may never know exactly what shifted, only that it was improved, or optimized, or aligned with the latest guidance. Over the past few years, medical devices have been recalled, not because metal failed, but because software needed correction. Patients weren't called in because something broke. They were contacted because something could behave differently under certain conditions. Most were told it was precautionary, handled. The human decision here was transparency filtered through reassurance. Tell patients enough to maintain calm, not enough to create panic. The consequence is quiet dependence. You rely on something that can change remotely. You depend on code written by people you will never meet. And this is where the assumption failed. We assumed medical devices were static once implanted. But they are living systems now, not biologically, digitally. They log data, transmit patterns, receive refinements. Each connection exists to improve outcomes. The human decision was to allow devices to communicate beyond the body. Because shared data helps research. Because monitoring can prevent emergencies. The consequence is exposure. Not exposure in a dramatic movie sense. Exposure in the sense that more systems now sit between your body and certainty. Hospitals depend on networks. Manufacturers depend on servers. Devices depend on signals. And if any layer behaves unexpectedly, the ripple doesn't stay abstract. It becomes physical. Most patients never hear this part. They hear about innovation, smaller devices, longer battery life, smarter algorithms. They don't hear about how complexity increases dependency. When something is mechanical, failure has limits. When something is digital, behavior can shift, quietly. And because it's healthcare, the stakes are personal. The human decision at the center of all this was compassionate. Reduce invasive procedures. Allow remote care. respond faster to new medical findings. All good intentions. The consequence is that your body is now partially governed by something updatable. That word sounds harmless. Update. But updates imply version numbers. And version numbers imply that what you have today is temporary. This doesn't mean devices are unsafe. It means they are dynamic. And dynamic systems require constant trust. Trust in security. Trust in design. Trust in the invisible layers you cannot audit. Here's where it stops being technical. Imagine receiving a notification about the device that keeps you stable. An update is available. You're told it improves reliability. You're told it addresses an issue discovered under rare conditions. You're told everything is fine. The human decision is simple. Approve it. Because saying no feels reckless. The consequence is surrendering control to something you cannot meaningfully evaluate. And this is the part that lingers. Medical technology used to be something installed and left alone. Now it's something maintained remotely, continuously refined, continuously adjusted. We traded permanence for adaptability. For many people, that trade saves lives. But it also expands the attack surface of the most private system you have, your body. Not because someone is actively trying to interfere, but because every connected system inherits the realities of connectivity. So the next time you hear the phrase wireless update attached to a medical device, pause, not in fear, in awareness. Because the most intimate computer you may ever rely on isn't in your pocket. It might be keeping you alive. And that raises a simple human question. When your health depends on software, who is responsible for keeping it steady?